I think principally stroke is a long-term condition, and often patients and their carers are left to manage lifelong disability. And certainly what was key from the National Stroke Strategy was that that's the most important aspect to patients and carers, their lifelong disability. And we only see a snapshot of that in secondary healthcare. And so what is very difficult is managing a journey that goes through secondary health, primary health, involves social services, involves the voluntary sector. But it's important that that team as a whole, across those many barriers, works together to ensure the best long-term outcome for the patient and their carer.
On a formal basis, we have the MDT meeting every Thursday where we all get together, but that isn't and wouldn't ever be enough to make the ward work. So informally we work together all the time, and we've worked together a long time, so we play to each other's strengths. So for example, I wouldn't presume to say a patient is okay to walk until Cheryl, the physio, had seen them and said, yes, you're right, okay, go ahead with it. Similarly, I would never dare feed a patient until Carol, the speech therapist, had said, yes, it's safe. So because we've worked together for so long, we play to each other's strengths. And we're also good friends now, so it's just very informal, but works for us.
I think if communication is poor in any area, if somebody's new to the area and they don't understand the processes, that can lead to a breakdown, and there's breakdowns in communication. I think it's been important also for us to develop links with the community and the other stroke units in the area as well.
Multidisciplinary team is often quite stretched in terms of the volume of work it has to do, because as well as delivering a service, they also have to train people who are starting new in that profession to keep up their own training. And there are many disciplines where there is a serious national shortfall. Speech and language therapy, psychology, dietetics are all important members of the multidisciplinary team for stroke patients, but often can't be represented at every meeting simply because their numbers are lacking on a national basis.
You have mutual respect from other team members, and especially when that comes from the top as well. That's really important. And valuing each other's input into that patient care.
Team working is critical, and I think for teams to work well together, we all have to recognise the contribution that we can individually make to a patient's care and also to supporting the carer. And that said, at the end of the day, there needs to be a decision made, that there needs to be a path that is right to follow, and it means all team members feeling that their input is valued and recognised, but we all contribute and agree on what are realistic short, medium and long-term goals. And therefore any team must have a leader, and perhaps, as I've mentioned before, historically that's one of the medical consultants' role within the team, but I think there are teams where it doesn't exclusively have to be the medical consultant.